Thank you, everybody, for your patience. Our closed session did go a little longer than we'd anticipated, and I'm just waiting for the councillors to refresh themselves and take their seats. Motion? Are you making the motion? Okay. Councillor Galloway?
Madam Chair, I just wanted to inform everybody that it's National Left-Handed Day. So the three of us, Karen and Jeff and myself, want a lot more respect today.
Just don't be doing any of your creative thinking here today. We don't want that. So we have a motion to reconvene into open session. I do want to note that there is actually a fourth recommendation in the closed session that we missed, being negotiations on behalf of the municipality related to an agreement. So a motion to reconvene, and Sue, seconded by Councillor Foxton, Councillor McGarry. All in favor? That's passed. Any declarations of pecuniary interest under the Municipal Conflict of Interest Act? Seeing none, we are going to start with the delegation. I hope that she's still with us. She is still with us, yay. Shelley Campagnola, Executive Director of Mennonite Coalition for Refugee Support. Thanks, Shelley, and thank you for your patience.
It's a big part of my job. Thank you, Madam Chair and councillors, for allowing me to be here today to present. I want to speak to you about the upcoming discontinuance of the transition child benefit. You should have received a packet outlining the presentation. If you have not, please advise whoever has got those to hand them out. As you well know, the Ministry of Children, Community and Social Services has announced plans to eliminate the transition child benefit effective November 1st of this year. This is an amount that was provided along with Ontario Works to support the needs of children whose parents, caregivers, guardians have undetermined, temporary or precarious immigration status and are thus not eligible for federal or provincial child benefits. This was considered a mandatory benefit as opposed to discretionary, and it is proven to be a lifeline to ensure that children have their basic needs met. Through their audit, the Ministry of Children, Community and Social Services identified a need to improve the delivery and monitoring of social assistance, and at MCRS we would agree with that. However, it is of great concern to us that the most significant step taken to date has been targeting the TCB, and thereby the most vulnerable of those needing assistance. Of all people receiving Ontario Works, 7.4% of them are refugee claimants. Half of them would be children. What makes claimants unique is their undetermined status, which delays their access to employment. Claimants must apply for a work permit and will not receive one until they have completed an immigration medical and their application for such work permit is approved. At present, there is about a 3-month wait for that. In the meantime, their only other source of income is social assistance. Our experience at MCRS is that most of the people we work with are eager to be working. They bring a strong work ethic. They have the same attitude as many of us do. If you don't work, you don't eat. They have a desire to be industrious and to contribute. And they also need to raise funds for the costs associated with their claims process and, if possible, to facilitate family reunification when their claim is approved. We are confident that in our assumption that this is a normative profile of other demographic groups that would also be impacted by this cut. Most of the people that we work with are employed within 5 to 7 months of being here. This is vastly different from the overall findings of the audit that stated the average length of time people depend on the program has nearly doubled, increasing from an average of 19 months to almost 3 years in 2017-18. In other words, the duration of assistance for claimants we work with is roughly 20% of the duration of all the other groups. Contrary to the negative rhetoric we sometimes hear, claimants do not come to Canada to live off the hard work of others. No one can really live for any length of time on Ontario Works, whether they are born here or were born outside of Canada. A single person will receive $733 a month. An adult with one child will receive $1,112 a month, and then $230 with the additional funds with the transition child benefit. Compare this to your base salary as counselors. You get that plus your pension. And imagine if we told you that you will receive a 17% pay cut simply because of who you are. You would receive $620 less per month and reduced pension amount as well. That cut would cover almost the benefit for 3 children. However, the greater point is you would still have about 3 times what that one adult with one child will have without the TCB. Financially speaking, claimants would have been better off staying in their country of origin, except that they can't. They have been targeted, tortured, imprisoned, or had their lives threatened. The story is common and can be summarized as follows. They escaped out the back door while the death squad was coming in the front door. This is not an exception. This is the norm. What they didn't do is leave a good life so they could come here and live in abject poverty, scorned and disbelieved by those around them. The good news is that 80% of the people we work with are approved to receive Canada's protection. So we are talking about people who are going to be in our community for a long time. Losing this benefit will have devastating consequences, not only for refugee claimant families, but also for 16,000 children across the province whose caregivers are on Ontario Works or ODSP and currently receive this transition benefit. Those children make up only 0.7% of all the children in Ontario up to 14 years of age inclusive. This removal stands as a threat to the health and well-being of vulnerable families, and therefore as a threat to the well-being of this community and others. It will put many low-income families in the difficult position of choosing whether to pay for rent or put food on the table. This is an impossible choice that will result in children being undernourished and families being put at severe risk of homelessness. There are already hundreds of children in Waterloo region who go to school hungry on Mondays because they haven't eaten all weekend. Their ability to concentrate, learn, and engage is compromised because of severe food insecurity. Many schools have clothing cupboards because families can't afford to do their laundry or to replace ragged clothing. This will get worse with the elimination of the transition child benefit, as funds needed to simply pay rent will be completely exhausted. Families will have to rely even more so on food banks and other charitable sources. As for refugee claimants in emergency shelters, they will not be able to secure and maintain housing accommodations, as the combination of rising rental costs and low social assistance rates means that housing will be entirely unaffordable for families on social assistance without that allowance. Those that have housing will be forced out onto the streets or into precarious circumstances, no longer able to pay their rent. This flies directly in the face of our region's housing stability goals and practices, which MCRS is well known for supporting and seeking to align with as well as we can. Many families will be at increased risk of exploitation by employers and landlords as the desperation grows to provide food, shelter, and basic needs for their children, driving them to do whatever they have to. We are working hard to develop programs and partnerships that meet their everyday needs. But these cuts serve only to increase the urgency of our efforts, and as a donor-funded organization, we are already running a lean machine. The elimination of the TCB is well beyond our capacity to make up for or address on our own. We have been working with other claimant organizations across the province to plead for change and for a revocation of the cut, recognizing the devastating effect this will have on communities across the province. Waterloo region was settled with the very kinds of people who are coming to us now. People seeking refuge and a place to be industrious, contributors to their communities, and to raise their children in safety. Some of the families we work with were in environments where the standard lesson for children was not learning to swim or to look both ways to cross the street, but how to duck in the car when the gunfire started. It is our understanding that there are at least 600 children and their families in Waterloo region who will be directly and deeply impacted by the loss of this benefit. At MCRS, we have identified 225 children within the scope of our influence who will be at risk each year. We can readily identify families that will be in high-risk scenarios in November and going into the Christmas season because they have no other options. I have provided in my presentation some numbers that you can look at. I want to particularly draw your attention to the 16,000 children across the province who will be impacted. That works out to $44 million a year. That sounds like a lot of money. But again, those children make up 0.7% of the children in Ontario. And these children are not eligible for all other subsidies available to the other 99.3%. Thus, these cuts are even more detrimental to their well-being because they are left with no other options. In addition, this amount represents 0.03% of projected provincial revenue for 2019-2020. Saving this percentage at such a high social cost that will reverberate financially and exponentially in other ways is not fiscally sound. No one fleeing persecution and seeking protection in our country should be at risk of such extreme poverty or such mistreatment, and certainly not the youngest and most vulnerable among us. Our ask to you today, please request the Premier and Minister of Children, Community and Social Services to revoke the planned cuts to the Ontario Works Transition Child Benefit to ensure the continuance and stability of concerted efforts to improve the well-being of Waterloo Region and other communities across the province in fiscally and socially responsible ways. Thank you.
You finished with 6 seconds to spare. That was remarkably well timed.
Thank you.
Are there any questions? I have a few. Councillor Galloway.
Thank you, Madam Chair. Really good presentation, Shelley, very comprehensive. I'm curious whether or not you have copied something similar to the area MPPs. If you've made, approaches to them, or even if you just sent something similar to them for their perusal.
We have, in partnership with the other 22 claimant organizations in Ontario, submitted numerous letters to the provincial government and often copy in our local MPPs to receive that information. I will be forwarding this presentation to our local MPPs as well.
That's good. Thank you. Madam Chair, I just wanted to ask staff, what implications does this have to our responsibilities and our program, if they're prepared to answer that now or at another point in time?
I think it's appropriate to ask it now. Mr. Murray, can you respond to that, or is there someone you would like to have respond?
Yeah, through you, Madam Chair. What we're doing in the One-Net Income Ontario Works program is we have started a working group of different program areas in the department to take a look at the effects that this will have on the individuals we work with who will no longer receive it. At this point in time, we don't know the full extent of what these changes will be.
And just one further question, does this tie in at all to the discretionary benefits issue that we've dealt with in the past? Separate, okay, thank you. Thank you.
Councillor Shantz.
Thank you, and thank you for your presentation. Similar to Councillor Galloway's question, I would suggest that face-to-face meetings with the MPPs would be maybe more effective than even a letter.
Yes, thank you. We do have quite welcomed access to MPPs that are in opposition parties, but we have not been even able to have a conversation on the phone with our sitting party members. Thank you.
Councillor McGarry.
Thank you. Just a quick follow-up, really following on the heels of Councillor Galloway's question to staff. I always find it important in the conversation of what the financial implications are to any group is to put in at least a ballpark figure of what might happen if they don't have this issue or they don't have this money. For instance, if they have this benefit reduced, what does that cost our society and all the other programs that we need to spend forward, whether it's health-related or policing? So if we can try and even ballpark some of the implications of what this might do for families, I think that's a good follow-up to any communication that you're providing to the provincial government.
Yes, thank you.
Thank you.
I just want to note in the presentation, we did say with 225 children, that would work out to about $60,000 a month, not going into our economy to pay rent and food. That's $60,000 a month less for those families, and those needs are going to have to come from somewhere.
And I understand that piece of it, if I may, Madam Chair. I think that if you can sort of follow through the thread of what happens when that family becomes, they're not able to be housed any further, the financial implications to the community for addressing that family's needs, and some of the implications that come from that.
Yes.
Thank you.
I agree. Thank you.
I have no other questions. I think I would like to make a motion then that that staff, with regards to your specific ask, that staff can provide a report with a little more information for council, and perhaps. Okay, that's been moved by Councillor Lorenz, seconded by Councillor McGarry. All in favor? Thanks. And is the next cycle timing acceptable? Okay, thank you very much.
Thank you.
Thank you very much. Okay. Did we vote? All in favor? Okay. Yes, we did. Do we? Any requests to remove items from the consent agenda? I do have a couple. I have questions having to do with items 6.1 and 6.3. They're simply questions. Do we ask them now, or do we approve everything else and then come back? Okay. Okay. With regard to 6.1, which is the Canada-Ontario Community Housing Initiative, one of the recommendations has to do with adding funding for a tenancy sustainability position. I do understand that that's funded by the province. I'm just curious about I'm not sure to look at, who's been here long enough to ask. Are we seeing a disproportionate number of evictions in community housing, or is this simply funding that the province is providing, so we're accepting it?
Thank you. And yeah, not being around long enough, what I'll do my best is to answer anecdotally. I don't think we're seeing a disproportionate amount of evictions from community housing. It's simply a position that hasn't been available to those housing providers in the past. The province is offering the opportunity to provide a position like this to ensure housing stability in that area, so we're looking to take advantage of it.
Okay. Councillor Verbanovich?
Thank you very much, and great report, and it sort of melds with one later in the agenda today as well. But I'm just wondering, we understand what this means in terms of dollar value, but I'm wondering if we can sort of get a sense, and in future, maybe housing reports can actually also connect the dollar value and in the report to actual number of units that are going to be provided or repaired through this, because I think that's something that the community can relate to, because that then starts connecting back to our waiting list and so on. And I'm wondering, like, in terms of this report, do we have that sense right now, or?
Are you referring to how many community housing units there are throughout the region?
No, but like the dollars that we're talking about, how many units will we be able to repair? How many new units will we be able to bring on stream? And we don't have that information today.
No,
then.
I think there's some of it in the report, and then Ryan or Jeff or Jennifer might be able to add more. I'm looking at a section in the report on page 10 of the agenda.
Yeah, there's a little bit there under rental
on
housing.
rental housing, COCHI and OPHI, I think I got the acronyms, COCHI and OPHI funds used for the construction of approximately 50 new affordable units. So that's that stream, and that's by far the largest stream. They may be able to comment on some of the unit targets on renovation and some of the other streams. I don't know, Ryan, or can anybody comment?
I'll defer this one to Jennifer or Jeff to take a stab at.
Through you, Madam Chair. The repair side of the funding will depend on where we actually land and what work is actually being repaired. Our last program, the SHIP program, about $900 per unit would be an average of how the repair funding. But if a roof is the unit the repair work that's being selected, depending on what property it is, that will relate to the number of units that are affected. So it'll be based on the highest need for health and safety capital repair work. So the number of units impacted might not be known yet, but historically it's $900 per unit is the outcome of on the impact.
Okay. I guess where I'm going with this, and in recent weeks we've seen a number of announcements in different cities across the country in terms of additional new housing units and so on. And is that out of sort of a similar envelope to this one, or is it out of other envelopes? I'm just trying to get a sense of, what's it going to take for us to get access to some of those significant numbers of additional units as well in this area, because we know we have a huge backlog.
So this is different stream of funding. The COCHI and OPHI are a different stream of funding, and we may be talking about some of the other funding coming under the National Housing Strategy and the co-investment fund and the rehab and the repair program. It's complementary funding, and they will all have the same. We haven't been able to access that funding yet, but that will be coming through our other programs, and hopefully some of the transition funding will work to develop our frameworks and our programs to access that additional funding.
Okay, great. Thank you.
Okay. Thanks, Jennifer. My other question had to do with item 6.3, which is the Paramedic Services Performance Measurement Report. Oh, sorry, Jeff, I didn't see you. Go ahead.
Have we moved the consent agenda and any discussion on that?
We're asking the questions. There were two items that I wanted to ask questions of.
Well, I'd like to ask questions too. I didn't realize, have you moved the consent agenda, or has someone moved it? And no, so I think we need to do that.
I did invite questions.
I'm sorry?
I did ask if people wanted items brought forward.
Okay, usually we move the consent agenda and then there's questions before we vote on it. So at some point, I'd like to ask some questions as well.
That's absolutely fine. So we'll go back to the request to remove items from the consent agenda.
Okay, I can.
Yes, go ahead.
Sorry, Madam Chair. I just wanted to make sure I understood what. So I do have a couple of questions for the chief in the Paramedic Services Performance Measurement. Use your right hand. I use my left hand. Am I on? No. Okay. So honestly, I still don't like this system. I can barely hear when some people speak, so maybe I need to move closer. I'm not sure. Anyway, Chief, I'm looking at the information that was included in our package, and I just have a couple of questions for you because we don't seem to be making any headway on this, and I'm wondering if really offload delays are the source of most of these dismal numbers that we see here. I mean, we're throwing resources, we're planning on throwing more resources at the service, and the numbers don't really change that much.
So through the chair, so when we look at the results of the performance from last year, all of last year and this year, specifically this year, most of the numbers are actually trending in, I'd say at this point, in a very positive direction. So our response times are going down. We're in compliance with our response time performance plan. But our offload delay, we certainly are challenged with when it comes to the offload delay. And there is an initiative underway with Mr. Murray and the area CEOs of the hospitals to take a look at that and a deep dive into the offload delay issue that's happening in the hospital. There's been a project charter drafted, and we're currently in that discussion for that. So we're hoping that we can attack that problem through this Lean Six Sigma project, and try and reduce the amount of offload delay within the hospitals.
Okay. So I look at Kitchener, we're trending down, we're 2 seconds quicker than last year. I don't see that as a big improvement, but I would agree with you. And my understanding is that there's about 40 to 60 beds sitting empty at Grand River Hospital. I don't know if you're aware of that, or that they've let 40 nurses go there.
Right. Through the chair, sorry, I'm not aware of their staffing complement.
Okay. Well, I know that this premier wants to deal with hallway medicine, and now it looks like he's got empty rooms where he can just move patients into the rooms and not have the hallways so cluttered. My concern, I think, and we've discussed this before, is there's two issues really. One is multiple dispatch systems in Ontario. Other municipalities control their own destiny. I don't know why we can't do that. Niagara does it, Toronto does it, Muskoka does it, to name a few, Ottawa. So we need to figure out a plan how collectively, and I know your organization has been working on this, but as municipalities in Ontario, we need to figure out how we can control our own destiny. The second, I think, is the law that hasn't been, it's on the books, but it hasn't been passed yet by this government, is alternative destinations for ambulances, where you can take someone who broke their arm, instead of taking them to a hospital, take them to a critical care clinic or some other. And to me, that makes so much sense. That takes away some of the offloads and the loading at our hospitals, and this government hasn't passed that either. So it's been suggested that we should sit down with our 3 elected MPPs. I've never met any of them, to be honest with you. It's been over a year. And I find that to be a waste of time. We need to figure out, Chief, a better way of being able to get our message out to the province of Ontario, to the Minister of Health, and to the Premier. Now, I know some of us are going to AMO next weekend, and I certainly plan on trying to buttonhole as many people I can on these 2 important issues. But at the end of the day, whether it's your association or whether it's our association, we need to keep putting the pressure on and figure out a way how we can get this done. It seems to me they're pretty 2 simple things, and it behooves me that we can't get that passed. And one other comment I just want to make, Madam Chair, is my understanding is when this government was in opposition, they were hounding the previous government about implementing these things, and now when they're the government, nothing seems to be happening. I think that's pretty ludicrous in my opinion. Thank you, Madam Chair.
Councillor Galloway?
Thank you, Madam Chair. I'm glad that Councillor Lorentz has raised some of those issues. I want to raise one more in the same regard, but just to augment, you know, the offload delays. If we ever did get rid of hallway medicine, as has been promised, then of course offload delays should disappear as well. The dispatch, I mean, we've been harping on the dispatch matter for a long, long time, and the pilot projects have been going on for since my firstborn, I think. So when do these pilots end, and when can it be rolled out to the rest of the province? Why do certain municipalities get the benefit of having their own dispatch system, and yet we still have to to have what a lot, we could, as our master plan or our reports in the past, we could cut almost 90 seconds out of a call if we were dispatching ourselves. But yet we keep backfilling more and more paramedics, which we need to do because we need to provide a reasonable level of service. But there's just so many things. And then we have our budget cut. Councillor Lorenz didn't mention that, but we'll be talking about that later in the Finance Committee. The budget cut on EMS at a time when, you're right, Chief, our numbers are trending a little bit better, but they're not trending enough better. And we have these other factors. If we could get offload delays out, if we could have our own dispatch system, we could have just a tremendous response time to support our community.
Councillor Harris?
Yes, thank you. As the regional rep also on the St. Mary's Board of Trustees, we have raised this issue at one of our recent meetings as well. And I know that, we've encouraged hospital senior staff to continue to work with local officials on this matter. So I know that the hospitals, in fact, take this issue, I think as serious as perhaps you and us. I just want to also chime in perhaps in a comment also on Councillor Rentz's, remarks with regards to the longstanding advocacy on dispatching. Of course, I happen to have been there and was one of those individuals, and I concur with his assessment on that, this is something that perhaps the province should take very seriously to, improve patient outcomes, especially in emergency cases. I guess I would also reiterate, and perhaps council at another date can signal more official response, but the technology, again, that those other jurisdictions use, like Niagara, are way more advanced, frankly, than the technology that's being deployed here in our community. There was, I believe, capital put aside, budgeted for this particular investment, and we need to continually keep our eye on the ball in terms of when that rollout will happen and not allow for the deferral of this important rollout of technology that will further enhance response times while also advocating for local regional dispatch to work collaboratively with our other emergency partners like Niagara, Ottawa, Toronto. And if they believe in the same outcomes that we do, they'll move forward in this direction. So I guess I'm kind of throwing it out there. If there's perhaps another time we can craft a resolution or what have you, but I wanted to make sure I get that on the record too. Thank you, Chief.
Thanks. My question was also about the dispatch system, and maybe I'm a bit of a Pollyanna, and maybe I've misread the report. It's been a concern of ours that the provincial system tends to rank too many calls as urgent that aren't in fact urgent. Something in this report suggested to me that maybe that's improving a little bit. Am I correct in that?
So through the chair, so that number, it fluctuates up and down, but you are correct. Historically, the DPCI or the Dispatch Priority Card Index system that they use to triage calls over prioritizes call, and that's from a risk management piece on the ministry side. Where if we went to the AMPDS, which was the medical priority dispatch system, which was referred to by Councillor Harris, it actually has a more accurate way of triaging those calls and reduces that substantially, and that also helps in maintaining resource levels as well.
Okay, thank you. Councillor Redmond? Chair Redmond?
Thank you, Madam Chair. Through you, I think the points that raised are all really relevant. This has been an ongoing initiative that successive councils actually have raised with the provincial government of the day. And Councillor Rentz is quite right that there are a couple of more promising possibilities with paramedics being able to take patients to different destinations. But I did want to ask the Chief, you referenced the Lean Six Sigma initiative. I think that's a real promising deeper dive into this. Do you have any timelines about when you think you'll be able to come back with any kind of a report of results once this has been put under the microscope?
Yeah, through the chair, I might comment on that. So we're just getting rolling on that project, and I imagine it will not be until early 2020 that we've got any substantive results coming out of that. One of the challenges, and I think we're going to tackle it in a kind of phased way, one hospital first, followed by the other two. Some of the hospitals have just other constraints. They're rolling out a whole new hospital-wide information technology system, and I think that's impacting their ability to dedicate resources to this. So getting rolling on it through the fall, and then I'm hoping something will come out of it early in 2020.
And just, council, I think, is aware of this, but rest assured, at every opportunity, we do make this request and the urgency of this request to MPPs and cabinet ministers.
Seeing no other requests, can I have a motion to approve the items or receive them for information? Councillor Foxon, seconded by Councillor Yaworski. All in favor? That's passed. On to the regular items. Our first item is a report from Public Health and Emergency Services, and I believe we have opening remarks from Mrs. Quigley-Hobbs.
Through you, Madam Chair. Good morning, councillors. Before you today is a report outlining the progress of the implementation of both the interim and permanent consumption and treatment services at 150 Duke Street in Kitchener, and the status of the consumption and treatment services site identification process in Cambridge. The summaries provide detail to the exemption and funding applications, the site planning, and communications and community engagement, including the Community Advisory Committee terms of reference. We're continuing to move forward with the development of services and are working through issues as they arise. Over the weekend, it came to our attention that a residents group has interest as a key stakeholder on the Community Advisory Committee. Staff will work with City of Kitchener staff to facilitate this connection and update the terms of reference to reflect the addition. It is important to strike a balance between a workable number of members to ensure the group is productive and responsive, and at the same time, to the best of our ability, representative of the key stakeholders at the table. Also important to note are the multiple draft communication or community engagement strategies outlined in the Community Services Report. It highlights multiple ways of connecting with our community to ensure the services are not only responsive to the needs of clients, but at the same time positively integrates the service into the community. Staff will be having their initial meeting with the Community Advisory Committee in September to review and provide feedback on these draft engagement strategies as one of the items they will review. Staff will then provide an update report to Community Services Committee on the more detailed strategy and implementation plan.
I don't see any questions. I'd just like to make a comment that I think that with regards to the advisory committee, this was a best practice that I believe our steering group had identified in their research, as well as in the work we did over last year to identify our Made in Waterloo plan. So I think that the work that I've seen done by other steering committees, that I'm thinking of South Riverdale, very impressive work. So I'm glad we're doing that. But I do just want to reiterate that is not by any means the only way that we are going to engage with the public around this. So individuals who aren't on the committee don't need to worry that they won't have any opportunity to have their voices heard.
That's correct. Thank you.
Councillor Shantz.
Thank you, and thank you for the report, and thank you to staff for all the work on this. It's been a bit of a it's been a difficult go. My question, and maybe it's embedded in the report, but I missed it. In terms of the interim site and wraparound services, I understand that it'll take time to get all of those in place, and then they are very important. What other services will be provided at the interim site, if any? Or does everything else wait until the permanent site is in place?
Through you, Madam Chair. These will be primarily the services that you would have seen at the previous overdose prevention sites. So it will provide supervision over injection. It will provide harm reduction services, but it's basically very simple overdose prevention activities that will happen during the interim site. Once the permanent site is underway, you will see the expansion to include more addictions treatment services support. There will be engagement with primary care, community and social services, and as well a number of other support agencies in the area that will wrap around, if you will, the clients.
Could you clarify why those won't be available at the interim site?
So there's a couple of considerations. One is that there's space. For the interim site, we will be operating out of the second floor in a very small space that really only just allows for the supervision and the harm reduction component. Once we are able to renovate and move into the first floor, we'll of course have more space to bring those services on site. Staff, of course, will work to do as many warm transfers and referrals as possible in the interim site, but it just will not be as expansive in terms of services available.
Thank you.
Councillor Galloway.
Thank you, Madam Chair. On page 2 of the report, it talks about the terms of the lease are still being negotiated, and do we know when that will be concluded, and how is that affecting renovations or the commencement of renovations?
Through you, Madam Chair. Right now, we're hoping to have the lease completed by the end of the week. We are moving forward with the other design and development components of it. There's really no showstoppers that we've come across at this point in time. We're just waiting for a couple of recommendations from consultants on some design requirements, and then I believe we will begin to see shortly thereafter work done on the interim site, and I believe the tenders are still on target for the permanent site at this time.
And Karen, when we were discussing, at least in one particular meeting, the interim site being on the second floor, there were concerns about washrooms and life safety issues, exits and so on. Have those all been resolved?
Through you, Madam Chair, I believe we have met all of those design requirements, and I think, as far as I understand it, we're good to go.
Okay, and Madam Chair, I want to just add as well Councillor Chance's thanks to staff, Karen and Grace, and a whole lot of other people who. And we're not there yet, but we'll get there very soon. Thanks.
Councillor Jowett.
Thank you, through the chair. Yeah, I have to echo certainly Councillor Galloway's kudos there for all of the hard work that everyone has done on this file. I was just looking back on some reports after this report came out, and I kind of wondered, and maybe given the organization has such anonymity, that could be why we have not been able to, or maybe we have engaged them and I just haven't seen it, but I'm looking for the strategic input and engagement of Narcotics Anonymous and Alcoholics Anonymous. In fact, I think they do have something to bring to the table here, and some of the basic tenets of dealing with addiction issues. So I've wondered if, and I know it may be even kind of late in the game, but even Cambridge has an opportunity to engage them in their wellness committee. Is that something you have any commentary on?
Through you, Madam Chair, I believe we would have done a lot of our consultation with the addictions group that focus on really the methadone and Suboxone types of supports, but certainly we can take under advisement, including these groups in further consultations, and as well in any work that goes forward with the Kitchener site.
Yeah, for sure. I think that's a huge gap if we haven't, I think they should be front and center, actually. So if we can see some more input there, that'd be great. Thank you.
Councillor Verbanovich.
Thank you, Madam Chair. And I too want to add my thanks to staff for all the work that they've been doing in terms of advancing this. And it's certainly great to see that we've obtained the necessary approvals, both for the temporary and the permanent site. For those of us that were at the Premier's announcement last week, one of the questions that he was asked by the media was where this site is at in terms of its funding. And while he did not make a commitment with respect to it, he did indicate he was in favor of comprehensive wraparound sites. And as I said to one of the media outlets afterwards, that certainly was encouraging, because that's very much the Made in Waterloo region solution that we've put forward and proposed to the province. And so I would hope that certainly helps expedite our funding application from their point of view, because it seems to meet the needs of the government. I did want to just touch on one thing in the report, and it's one that you, Madam Chair, had emailed some of us about on the weekend, and we've seen some dialogue on social media, and it's with respect to the representation piece. I really like the approach that's been taken here, and I also like the fact that we're not looking at putting politicians on it now, unless until we see how the provincial public health model changes, because we have our opportunity here and at Municipal Council to address these issues, and this is really an opportunity for the broader community. But in particular, in terms of the residents of surrounding neighborhoods groups, I think we need to look at two things. One being the Old Berlin Neighborhood Association has two individuals identified. I think we should split that up into Old Berlin Town and then the downtown, because the boundary actually is a block west, east, north, depending on which way you're looking at it, in terms of the actual neighborhood associations. And so that would allow a little bit better representation. And then I think the other piece that we may want to consider, and I think there has been some attempt to reach out but I'm thinking in particular the apartment building next door. We might want to see a representative from that building, because I know, certainly in speaking with the superintendent, there's a desire to have active dialogue there. And I know we haven't been able to make contact with the owner, but I'm hoping that perhaps that's a position we can add into the group here.
Through you, Madam Chair, it was just late yesterday that we managed to connect with the owner, who will be joining the Community Advisory Group.
Oh, great.
Yes, but yes, all your points are well taken. Thank you.
Okay, so I don't know if anybody's moved this yet, but if they haven't, when the time comes, I'm prepared to move it in with those changes.
I'll come back to you. Councillor Lawrence.
Thank you, Madam Chair. Through you, I'd just like to thank Dr. Wang and Karen and her team. This has been a really, really long road, and I thought when we started it, it would be a lot simpler than what it became. So kudos to all of you and your team. You worked really hard at this, tons of public meetings, some good, some not so good. I don't know how we could have did it differently, but all of you worked in a very professional way with the end goal in sight, and we're so close now. So congratulations, and thank you again from the bottom of my heart. I know when I was chair, we had a lot of different discussions and meetings and issues dealing with this. So I'm really excited. I guess the only thing I want to ask is the expected time frame for the interim site. Is that firm? Will it be finished by the end of September?
Right now, we still are targeting end of September for opening of the interim site, yes.
Very good. Okay, thank you.
Councillor Kiefer.
Thank you, Madam Chair. Through you to Karen. Thanks to staff, first of all, as well. Many thanks for all the hard work. But Karen, with regards to the consumption and treatment services in Cambridge, I know that there was a professional facilitator that was supposed to participate in that. Has that been made public yet?
Through you, Madam Chair, we provided the update to Cambridge City staff for review before putting it in the report. So unless Madam Mayor has more up-to-date information, it was reviewed by city staff prior to being published in this report.
I see. And do you have any, and my follow-up question is, do you have any other current information since the Cambridge Council passed this on June 19th?
Through you, Madam Chair, only that the staff are now working to ensure membership on the community well-being group. And I know they have reached out to a number of stakeholders, and public health will assume status on the group as a non-voting member.
Thank you very much.
Councillor Jowett.
Thank you, through the chair. So I just want to do some housekeeping, because I know this is how sometimes things can kind of get left behind. So on the motion that's on the table, am I able to add direction to staff to engage NA and AA organizations in some of the information sharing?
My understanding is that Councillor Vrabanovic is going to move a slightly amended motion. If I've got the Robert's rules right at that point,
Will be covered?
You're able to introduce another element.
So has that actual direction to staff been included in Councillor Vrbanovic's motion?
He hasn't made it yet.
Will you do so?
Which direction?
To engage NA and AA organizations in input into the advisory group.
So I think, like we heard from, are you suggesting that they need to be members, or that staff would simply consult with them?
I think they should present to the group. I don't think it should just be an engagement with staff. I think that there should be some, there's much education to be gained from them.
Okay.
So I'm just looking for a way to have the input.
So I mean, I'm certainly happy to add that staff engage NA and AA as appropriate. I mean, I think the working group can figure out those dynamics. I'm not sure we should be specifying what or when necessarily.
I think that's why I'm trying to be vague. I'm not saying how they are engaged, but I certainly think that it's not just with staff. I think it needs to be with the group itself.
Yep, I'm sure, yeah.
Right? Without being too definitive, there needs to be a level of awareness. If the group is making the decision, they should probably present to the group.
Yeah, and I think staff have heard that, and we'll take it under advisement.
And my understanding is that it doesn't get taken as a directive unless we put it in the motion, so. Am I not? I've had it happen before. That's why I'm making sure. I want to be clear.
I'm not, did you?
I can make the amendment myself if it's easier.
Sorry, I just wanted to perhaps add that staff, because our specialty isn't actually treatment, we consult with the most significant treatment partners in our community. So we would be very happy to bring this information back to them and then discuss with our treatment partners maybe what is the best way for the information from these organizations to get out to other people who may need to who may benefit from having it. I think it may be challenging at this point to specify specifically what these groups should do in the context of the work that we're doing already with the main treatment providers in the community. I don't know if that helps.
NA and AA aren't at that table then? Is that what you're telling me?
What I'm saying is we sort of rely on the treatment partners to provide advice to us as a group, and we do have a treatment pillar under the drug strategy that's chaired by the House of Friendship, and we understand they work with the other providers and they come to us with recommendations. We're not involved in the specifics of who presents to who, for example. So, but for sure, we definitely, your point is well taken. We need to include all the partners, and so my suggestion would be that your direction could be to staff to bring this back for consideration on how to ensure that we are consulting with these groups.
Okay, and again, I'm not trying to be difficult. It's just I know that if we're not clear about what we expect, sometimes it's and I mean it's not certainly anybody's fault or intentional, but sometimes these things don't actually end up seeing light of day, especially if it's just a small point that maybe doesn't seem relevant to someone else. And I would, like I said, I went back and I was quite surprised that we haven't really had as much engagement with them as I had thought we would have in specific to addiction. So I'm just hoping that we can close that loop off.
So as far as I'm aware, NA and AA aren't, strictly speaking, treatment providers. It's a support group for people who are following an abstinence-based model. So my assumption would be that any of the partners that are providing treatment or making referrals to treatment would be making referrals to those groups if that was something that the clients in question wanted, but we can certainly confirm that.
Yeah, I think given their success rates, probably would make sense. They're more of a sustainable long-term sort of.
Yeah, they're an ongoing support. Yeah.
Okay, thank you.
Councillor McGarry.
Thank you. Through you, Madam Chair, I just wanted to provide a quick update to Karen Quigley-Hobbs and Councillor Kiefer. The process by which Cambridge staff and council are working with the region in order to provide a potential location for a possible CTS site in Cambridge is tasked to the new Community Wellbeing Advisory Committee. That committee now has its membership out, and we have identified the council members that will be sitting on it. This committee group will get going in September, and from that we will have some of the details on what the process is going to look like in order to provide consultation and facilitation for a process to find a potential site for a CTS. If that addresses your questions. Thank you.
Thank you. Councillor Armstrong.
Yes, through you, Madam Chair. I just want to express my gratitude to staff for all the hard work, but I also want to express my gratitude to my fellow councillors around this horseshoe at their persistence to try and get something like this going. And this is anticipation that it's going to arrive in September and that we are making headway into a problem that is nationwide and in fact probably worldwide. So I just want to, I think that the entire council as well as staff need to be pat on the back for being persistent and pushing for this. Thank you.
I have one tiny technical question. In terms of the one-year exemption, when does it start? Does it start at the time that we get the approval, or does it start when we actually begin service?
It will start at the time that we receive the approval, which I believe was July 25th. So we will receive notification from Health Canada, likely in the spring, that they will look to us to alert them if we plan to renew, and they will get their renewal process underway well in advance of July 25th, 2020.
Okay, thank you.
And that's pretty much standard of practice with all of the sites.
Councillor Urbanovich.
So I guess at this point then I'll move the motion with the changes to representation, namely that we deduct one from Old Berlin Neighborhood Association, add one to Downtown Neighborhood Alliance, and one for the adjoining building next door, whatever the property address is. And further, that we also give direction to staff to engage with NA and NA with respect to any support they can provide to the community advisory group.
Do I have a seconder for that? I'll second. Oh, saw Helen first. All in favor? And that's passed. Thank you very much, everybody. I'm going to take an opportunity that just to put in a plug for Overdose Awareness Day that's coming up. I believe it's the 19th in Cambridge and the 26th in Kitchener. You can correct me. If council and members of the audience haven't had a chance to attend one of these, they're really, really powerful and very moving events. People with lived experience of substance use and of losing family members to overdose speak, and there's pizza. So it's a very good event, and it's sponsored by the region, I understand. Okay, on to item 7.2, Region of Waterloo's response to provincial public health restructuring and funding changes, and I understand Ms. Lorp is going to give opening remarks.
Good morning, Chair Clark and members of Community Services Committee. The report before you this morning includes three things: a high-level description of the province's plans for funding and structural changes within Ontario public health sector, the potential impact for Waterloo Region, and recommendations for the region's response to the proposed changes. In April this year, as part of the provincial budget, the government made announcements that will significantly change both the funding and structure of Ontario's public health sector. If implemented as planned, the changes would result in the creation of 10 new regional public health entities governed by autonomous boards of health effective April 1st, 2020, as well as provincial funding within the sector will be reduced by $200 million annually by April 1st, 2021. And finally, the cost-sharing arrangements will be adjusted, with municipalities expected to pay a greater portion. Once the changes are implemented, Regional Council will no longer operate as the local Board of Health. Region of Waterloo is in a proposed public health entity that includes current health units of Wellington, Dufferin, Guelph, and the regions of Peel and Halton. It would be the largest public health entity of the 10, with an estimated population of 2.9 million people. The full financial impact to Waterloo Region resulting from the transition is not known at this time, but the total annualized loss of provincial funding is estimated to be $5.4 million, excluding any budget changes resulting from the amalgamation of the 4 current health units. The province's planned changes to both the structure and funding will have broad implications provincially and locally. Our observations and feedback contained in this report are presented in the interest of maintaining a strong system provincially and building on the strengths and success of the current public health service delivery locally in Waterloo Region. They are as follows. Changes to the public health sector should maintain and preserve the mandate of public health. The current structure, organization, governance, and accountability for public health programs in Waterloo Region is working effectively. Any structure changes should be better or at least equivalent to what currently exists locally in order to justify the disruption and the risk to effective public health service delivery. The proposed public health entity that includes the current health units of Wellington, Dufferin, Guelph, and the regions of Halton, Peel, and Waterloo is too large, and this proposed grouping should be reduced in size. The proposed changes will have significant impacts on funding and accountability for municipalities and have the potential to create barriers and weaken collaborations and partnerships locally. The province's proposed timeline for implementation of the changes is extremely ambitious, and the government should consider a phased-in approach with a longer transition period. The province has committed to a consultation process with stakeholders, and the focus of the consultations are expected to include the areas of geographic boundaries, governance, and leadership of the new public health entities. Legislation is expected to be introduced by the government in the fall, when the sitting of the legislature resumes following the federal election at the end of October.
Thank you. Chair Redmond?
Thank you, Chair Clark. I would be pleased to move the recommendations. And just to add, bullet point G talks about the Association of Municipalities as well as the local public health agencies. I'd also add to that the Organization of Mayors and Regional Chairs of Ontario. I'm chair of that, and we too have been bringing this issue forward and very supportive of the recommendations as written.
We have a few questions, and then we'll come back to the motion, if that's okay. Councillor Galloway.
Thank you, Madam Chair. I want to pay particular note to a paragraph in the report on page 7 of the report, 63 of the package, that speaks to something that I'm quite concerned about in the proposed changes to the system, and that has to do with the integration of public health into a variety of our service areas. And the value that they provide when we talk about transportation issues, when we talk about transit issues, when we talk about planning issues of all different sorts, and when we think of some really high-level, overbearing issues like climate change and the health effects of climate change, and we have a report on that in the Planning and Works Committee. That expertise and that knowledge is going to be sorely missed if, in fact, it's not provided in some other manner. So I don't know if it warrants something else in the report or in the recommendations that we're forwarding to the ministry. It's been highlighted in the report in one paragraph, but it's of significant concern to me, and I think probably to members of council, that we potentially could lose that expertise, that filter, that lens on a lot of our infrastructure projects and a lot of the things that we do that are really important to the well-being and the health of our community. And I'm talking about physical health as well as mental health. And whether or not we should have something in the recommendation that speaks to that being accommodated, and if they're going ahead with this particular initiative, that somehow or another there needs to be that resource made available to us from these health groups, whatever they're going to be called, with Peel and everybody else. It's just hard to imagine the governance of that organization covering that area, that they're going to be sensitive to a local need that maybe Peel would like to have, but maybe they don't see it quite the same way. I don't know. But we might have a particular request. Now, whether or not they charge it out on some kind of fee-for-service basis or they provide it within their global budget, I think it's worth noting, and I would like to see something in the recommendation that provides for that to be accommodated if, in fact, they go ahead with what they're proposing.
Do you see that as an addition, an expansion of C, or a separate? C speaks about municipal representation.
Madam Chair, I haven't crafted anything, so I'll take your direction if you feel it, or staff. If there's agreement, of course, we can debate it as part of an amendment, but I'd like to see it in the recommendation that it's on the kind of the cover page of our report.
So a suggestion, if council is generally supportive of Councillor Galloway's suggestion, staff could, we can take this direction and amend the recommendations, probably add another clause, and council will need to ratify these next week anyway, and so what we could put on the council agenda would be a slightly revised version of this. Maybe staff work with Councillor Galloway to try to craft up, you know, a new clause that would reflect this. That, you know, if the province proceeds in this direction, that they ensure that regions have access to the appropriate public health expertise to fully integrate with transportation planning projects, environmental initiatives, and so on, that, you know, to maintain this fully integrated approach that we've had in the past. I think that's the gist.
Exactly
so we
it.
could, I think, fairly easily craft a new clause.
Yeah, it's not.
Bring that to council.
Okay, thank you.
Thank you.
And if I could just add a word, I wonder if maybe bullet A, Councillor Galloway, would be a good spot for that. I would have to tell you that one of the fundamental concerns that I have, in addition to the recommendations that are put before council, is the fact that we have save for pay, and it's a slippery slope if we start sort of doing one-off. So I would think that that might be an area where we would look at, because the fully integrated model, we could enlarge on that. I worry about the responsiveness and the accountability of a roster that has 2.9 million people in it, and it would be very easy to sort of offload services and say, if you want that, you have to pay for it. So I think amplifying the benefits of that, and as Mr. Murray said, ensuring that those kinds of services are still available is really important, but I don't want to be nickeled and dimed to death either.
Thank you. Councillor McGarry.
Thank you very much, and through you, Madam Chair. I have read the report quite thoroughly and, you know, agree with the comments of my colleagues around the table. But one concern that I have is that there does not seem to be a mention of IT systems and how the transition period is going to work to produce an IT system that all public health departments during their transition will be able to communicate with each other. From my perspective, having been in organizations where big IT systems roll out, it has never gone smoothly. This will be a critical piece of infrastructure for any amalgamation of public health units. In my estimation, I don't see any mention of this. We've talked about transition periods, we've talked about our concerns about the size of the unit, but nowhere do I see that there is work being done so that e-health records, digital imaging would be transferred and shared through all these different units that will be potentially coming together. So I would just caution that we have at least crossed our T's and dotted our I's and really put forward that question to the provincial government before it's transitioned, that we can ensure a fully integrated IT system and that it's operational long before those units go live on the actual transition day in the future.
I think our staff are still having flashbacks to SAMS, so they probably take those points. Councillor Shantz.
Thank you. Just further to Councillor Galloway's comments, I'm looking at bullet 6 on page 59, and it talks about the implementation, and it says a provincial vision of a strong, effective, nimble, and locally connected public health system. And if that's the vision that they have, I think that ties in very well to Councillor Galloway's recommendations, and perhaps that can be integrated in the recommendation as appropriate.
I see staff nodding. I don't see any other questions. I want to, sort of reiterate what's already been said. I don't think we can underestimate the significance of this change. One of the things that I've been responding to questions about is the cost. And one of the things that I've been saying to the media is, our cost is based on an estimate that we are going to continue delivering the same services that we're delivering, and this is what the impacts of the funding formula change will be. But we don't really know that. With this change, someone else is going to be making decisions about what services we deliver, and our taxpayers are going to be paying for it. So we're certainly going to be losing the integration that we talked about. We're going to be losing the control. I think the impacts, not just on us fiscally, but in terms of the quality of service, are huge, and we are right to be responding as we are to this. You have a motion, and Councillor Kiefer is seconding. All right, all in favor? Passed. Okay. Where are we now? We are now at 7.3, Ontario's Seniors Dental Care Program in Waterloo Region, another public health item, and Andrea Reist will be speaking to that.
Good morning, Chair Clark and members of Community Services Committee. This report provides an overview of the Ontario Seniors Dental Care Program that is currently under development in Waterloo Region. In Waterloo Region, nearly 3,000 eligible seniors are expected to seek dental service annually through the Ontario Seniors Dental Care Program, which was introduced by the provincial government earlier this spring and is to be in effect being implemented in the fall of this year. Up to $1.6 million in additional base funding will be provided to the Region of Waterloo Board of Health for this funding year. And in addition to that, as invited by the Ministry of Health, a capital application to expand and upgrade dental capacity within Waterloo Region for OSD for this program through eligible local service locations and in underserviced areas is also being submitted. Should the capital funding application that has been submitted for the required date of August 14th, there will be 2 dental areas located in Langs Community Health Centre, 2 dental areas located at Kitchener Downtown Community Health Centre, and 1 dental area located at Woolwich Community Health Centre that will be identified for the delivery of this program in Waterloo Region. Locations were chosen based on a review of where low-income seniors and long-term care facilities are distributed in Waterloo Region, as well as where eligible dental rooms are located. And consideration was also given to ensuring that dental services to low-income children are not negatively impacted by the addition of dental services for low-income seniors, and also by how many sites and how much service can reasonably be supported through the available annual funding envelope for this program. All 3 of the community health centres in Waterloo Region have indicated a willingness to enter into service level agreements with public health to deliver this program and have been diligently working with public health to develop the capital application and service delivery models in support of this program in Waterloo Region within very tight timeframes. Attending today's meeting, I would just like to acknowledge the following representatives from our community health centres in Waterloo Region who are here in demonstration of their commitment to this partnership. Bill Davidson from Langs Community Health Centre, the executive director there. Roslyn Bentley is the executive director from Woolwich Community Health Centre, and Ann Phillips is a health and wellness leader from Kitchener Downtown Community Health Centre, who are all here today in a demonstration of their commitment to this partnership. The program rollout in Waterloo Region, as I mentioned earlier, will begin this fall using existing resources and infrastructure in our community health centres to begin to deliver services to eligible Ontario seniors. And a Community Services Committee report will come later this fall in order to update the Board of Health on the status of the capital application process, which has been submitted, and we're now currently in the process of awaiting results of that from the province, and to provide additional information about the planning and rollout of this initiative in Waterloo Region.
I have one question. I don't see any others yet. Good news. I'm a little, I guess I'm going to look on the negative side. My understanding is that the province has identified 3,000 eligible people, but is providing funding for 1,500. How are we going to manage that?
Okay. So in terms of the estimate of how many people would be using this service in Waterloo Region, the province took a look at how many eligible seniors there would be across Ontario. And in our public health unit, it would be just under 7,000 in total. Based on their experience with the Ontario the Ontario benefit program related to drug benefit program, they have indicated that there would be about a 40% uptake of this. So that brings us to the approximation of about a little under 3,000 people. We believe that that is probably a conservative estimate of how many people may eventually use this service within Waterloo Region, and we'll be closely monitoring that once we begin the development of the program. It is identified in our proposal and our application to the province that we expect that that is a low number. Our estimate is that we would be able to serve 1,500 individuals with a full course of treatment in the course of a year. So that could mean that we're actually serving more than 1,500, but over time, as opposed to everybody all at the same time.
Okay, thank you. Oh, I have a question from Councillor Kiefer.
Thank you, Madam Chair. Yeah, my question is, what about seniors that are bedridden or in nursing homes or homes for the aged that can't get to the locations? Is there something in place for that?
We have had some initial conversation with Sunnyside Home in exploration of this. And currently there are service providers who work with long-term care facilities to provide dentistry services at the various locations. But they are, there is a fee associated with those. So we've identified that as an area that we will need to explore and consider how we might go about doing that. There are options within the parameters of the program as identified by the ministry that would allow us to look at and explore different ways for working in partnership with others in addition to community health centers in order to provide those services to low-income seniors in those locations.
Would you, that's very good. Would you have a timeline on when you're going to get that information back? Or
Our plan is to establish a community advisory committee to explore these issues of implementation of the program. I would say we would probably be able to speak to that by early next year.
Thank you very much.
Okay, I have no other questions. There is a recommendation. Oh, no, sorry, this is information. Thank you. So we're moving on to community services. Do we have to do a quick staff change?
Madam Chair, I suggest we take a small break.
We will take a 5-minute break? Okay, take a 5-minute break. Can you hear me now? That's different. Okay. Okay, let's resume. We're on to community services reports. Item 7.4, proposed loan agreement and update, Cambridge Shelter Corporation. I don't think we have a presentation on this, but the recommendation is in the package and it's pretty straightforward. I'm looking for a mover. Councillor Armstrong and a seconder, Councillor Erb, all in favor? And that's passed. Next item, 7.5, the 10-year Housing and Homelessness Plan Progress Report. Again, we do not have a presentation, but we do have a recommendation that we approve the 10-year Housing and Homelessness Plan Report as outlined. And I have Councillor Foxton moves and Councillor Kiefer seconds. All in favor? And that's approved. Item 7.6, the proposed approach to the development of the Children's Services operating budget. No presentation, but the recommendation is there. I do have a question if there are no other questions, and I'll ask it of staff. And it's just a minor one. When will the notice to parents of the toddlers and preschoolers about the termination of the pilot, when will that be provided?
Through you, Chair. The operators are receiving a letter today with information outlining and giving them information about how this will look, along with a heads up that we will be sending a letter for operators to send to families once approval has been received at council next August 22nd.
So it's imminent.
Yeah.
Thank you very much. So the recommendation is contained in the report to direct staff to develop the regional operating budget for children's services in accordance with the proposed funding allocation changes as set out in the report. Do I have a mover? Councillor Foxton, a seconder, Councillor Erb, all in favor? And that passes. We're on to interdepartmental reports. No presentation. This is another loan to a provider, capital loan to Erin District Citizens Association. And there are 2 recommendations. Moved by Councillor Foxton, seconded by Councillor Jaworski. All in favor?
I have a question.
Oh, I'm sorry. Sorry, Councillor Lorenz.
Well, yeah, just a couple of questions, if I could. So, as we move forward, I think there's been a lot of discussion about all municipalities trying to get in the affordable housing game. I mean, we understand that the need is very great. And I'm just a little concerned, are we setting a precedent here that every time someone goes through the motions and then finds out that their budget is overrun and there's a large shortfall needed, that the region's going to pick up the tab? I read in the report, I don't see anything about how this loan is going to be recovered. I think there's it mentions about if money shows up at some point in time, the way I read it, that they'll put it back into the fund. But I guess I'm just a little concerned. $240,000 is a lot of money. And if we're setting a precedent here, we may need to increase this fund by an awful lot to be able to cover everybody's shortfall in the future. So if I could get a couple of answers to those questions.
Sure. So I think there's 2 questions of staff, and one is what is our policy and practice around loans to providers, and one is specifically with regards to this loan, how it's going to be secured or protected. Is that something you can answer, Mr. Murray?
So the group had initially requested that we provide a grant to help with some of their shortfalls. We do get requests from time to time, but they did encounter a number of unexpected difficulties with this project. The intent is definitely that they will repay this loan. As compared to the overall budget, it is a small amount. There isn't a set time frame, but we're expecting around possibly a year or 10 at the latest. They'll start paying the loan over like a 10-year period, but it is definitely a loan, and there's every expectation that it will be.
So, thanks, Jeff, and I appreciate that. You say you get these requests from time to time. Have we had any of these in the past, and have those loans been repaid?
This fund has primarily been used for existing housing providers who have needed repairs to existing projects. So something built previous to 2001 and the transfer of housing. There have been several loans, sort of this loan fund. It is a loan fund, and some others. And we have received a repayment of this $450,000, which has allowed us to re-lend it out in this instance.
And how many years is that $450,000 taken to build up?
I'm sorry?
You say it's been repayments.
We received a repayment of $450,000. That was a one-time repayment by a provider.
Okay.
We had sufficient funds.
Have we ever used this fund and not been repaid?
I believe there are some sort of outstanding loans, but again, the intent is that it is a loan and it will be repaid.
So in the future, moving forward, we're going to continue this process. What happens when there's no money left in that fund? Has your division talked about that? Have we looked? I guess, it's just like anything else. I mean, if people start realizing that we have a fund to help offset, all of their plans that comes in over budget, and then there's a shortfall there, that the region's going to pick it up. Have we looked at beefing up this fund for the future, or where are we at? Maybe that's not a Jeff question.
Yeah, no, that's maybe not a fair question for Jeff. Craig might chime in. So I think the short answer is no. we haven't looked at beefing up the fund. I think the fund has worked in the past. And, as Jeff said, there have been a handful of these loans over the years for various purposes. They've been repaid or are in the process of getting repaid. So I think as part of the whole kind of housing and homelessness plan and allocating this, money that's flowing through the region, we have to continue to look at how these programs are structured, what funding's available. One of the previous reports talked about, we're doing a 5-year update of the 10-year homelessness and housing plan. And so, as part of that, we'll look at this. I don't think there's any intent to beef up this. I think there are other funding sources that, providers can access. And also, I think, keep in mind, the number of these funding arrangements that we enter into each year is pretty small. Like, there's a handful, like 3 to 5. So it's not like there's a big pool of these projects out there, just lining up for funds.
Sure. And I understand that. But I get the feeling and I get the sense, the people that I've talked to and the people that I've met with over the last couple of months, that everybody needs to concentrate their efforts on more affordable housing in the region. And I don't know if senior staff are aware of that, but I see this as setting a precedent. I don't have a problem with it. Obviously, we heard that this is really, that fund was not meant for this, but we're going to use it for that. But going forward, I don't know if you're aware of the increase in construction costs in this community. Everything's just taking off. So I guess what I'm saying is, and we're already getting some feedback from some of the things that we did today. I've heard people saying, well, gee, if you can give them a loan, why can't you give us a loan? Or why can't I get a forgivable loan? I think that's going to happen. In my mind, this is a precedent, and I don't have a problem with that as long as we're prepared to do something in the future for almost everybody, because people are going to go out to tender, and the numbers are going to be ridiculous, and they're going to be coming back to us with shortfalls. And if we're prepared to cover that, then we need to figure out a plan how we're going to do that. But if we don't have a plan to do that, maybe we shouldn't be doing anything. That's all I'm trying to say.
Councillor Foxton.
Thank you. And I see Jeff's point, but this association has been in existence, this group of volunteers, for over 30 years. They constructed this group of volunteers a multi-dwelling for residents within North Dumfries, provided apartments for them. They have now paid off in the $1 million range all of their loans. It's mortgage-free. They now are trying to do assisted living because a lot of our seniors who are of lower income want to remain within the community, and we do not have housing for them. You also have to remember, we don't have any other regional programs in North Dumfries. This will be one of the main programs the region has offered to North Dumfries. And this group of volunteers have always been committed to not only paying their debt, but being debt-free. And that's what they take great pride in. So I have no qualms at all that they will take care of this debt. And as Mr. Dyer and I discussed, he is aware of the good financial standing of this group of volunteers and how determined they are to make this work for the community of North Dumfries. So I hope you can have a little bit of faith in that alone. There are huge construction increase in costs, and I agree with Councillor Rentz in that manner. But this is an opportunity to actually bring the region of Waterloo into North Dumfries. Thank you.
Councillor Foxton, you wanted to move that motion then? You did, sorry. Sorry, you're right. No other questions? All in favor? That's passed. Our next item from Planning and Development and Legislative Services is the Region of Waterloo Museum's 2018 highlights and 2019 planned initiatives. It's for information. I have a couple questions. Councillor Yaworski?
Well, I just want to thank staff. It was a very extensive report with as much detail as we normally get on paramedics, so that's very good. So thank you for that. I noted a lot of Indigenous initiatives being planned or being considered, including a sweat lodge. And I just wanted to put out I've heard a lot in the community about discussions for a sweat lodge, so certainly I think you'll find continued discussion on that and enthusiasm for that type of facility.
Could use it.
Thanks. I had one question, and it's regards to the reference to the GRT stop. And I don't know that this is actually a question for you or for transit, but I'm just curious about how it works with our GRT business plan. We've talked about a stop at the museum for years, and I'm just curious about how that fits in terms of the business plan.
We can address that a bit better when Peter Zink is here during the Planning Works Committee, but essentially the issue of a stop at the museum is one of safety and crossing the road and us being able to provide that. And even it was looked at during the reconstruction of Homer Watson in that area, but it just is not possible for us to provide a safe stop at that location.
That was my recollection, and from when we've talked about it in the past, my memory is that we would have had to take a very circuitous route in behind and around, which would have extended the trip significantly, and I guess that's what triggered my question.
Yes, it would require us, I believe it's Old Mill there, to go up Old Mill and then through the neighborhood there and then back, which again impacts all of the other customers as well.
So this is a matter that's under discussion, but that's it at this point.
We're still looking at it, but not looking promising to being able to provide a safe stop there.
Thank you. All right, no other questions? This is an information item only. We have no items pending on the council inquiries and requests for information tracking list. Do we have any new requests? I don't see any. Any other business? I don't see any. And our next meeting is Tuesday, I hate even to say the word September, but September 10th. And do I have a motion to adjourn? Councillor Kiefer, seconded by Councillor Novak. All in favor, or do we need it? I never remember that. Right, we're adjourned.
Personal matter I need to attend to.
10th of this year. I now need a motion to go into closed session, please. Councillor Redmond, Councillor Kiefer, all those in favor? Into closed we go. I now need a motion. Well, I guess I'm adjourning after the closed, right? So we're good. Thank you.